What to do if a child has a long-standing stuffy nose? As a rule, parents usually seek help after a month or two after the nose has been constantly stuffy. But it's good that they still seek help even at such stages, because sometimes parents completely ignore this issue and do not seek help. The child gets used to the chronic stuffiness of the nose, parents get used to the fact that he constantly breathes through his mouth, and the child constantly experiences oxygen starvation, lags behind in development, and acquires various diseases associated with this. Therefore, it is very important, if you see that your baby's nose is chronically congested, to address this problem in time, because it can be solved and it can be eliminated. What are the causes of chronic nasal congestion in children? Mainly there are two. Either excessive swelling of the nasal mucosa itself, or excessive enlargement of the adenoids, the protective lymphoid tissue located in the nasopharynx. Regardless of whether it's the adenoids or just the nasal passage itself that swells and excessively inflates the mucous membrane, there is a certain triggering factor. This could be a superficial inflammatory process on the mucous membrane caused by a bacterial or viral infection, or the effect of inhaled air on the mucous membrane, or inflammatory processes in the nasal sinuses, but this is already relevant for children over 6 years old, or the effect of reflux disease, when there are throwbacks from the stomach into the esophagus, which irritate the respiratory tract, or a violation of the vascular tone of the nasal mucosa associated with problems of the spine, that is, a pronounced curvature of the spine or a condition after trauma. Regardless of what is the cause, 2 moments must be performed obligatorily by all parents. The first is to seek medical help. The second is to take measures to improve the work of the nasal mucosa, to improve the work and immunity, and to reduce the effect of inhaled air on the mucous membranes of the cavity and nose and adenoids. Of course, you should start with self-help measures, because this is the simplest thing you can do for your child. This is to ensure the conditions of the environment for the normal operation of the child's immune system, for the normal operation of the mucous membranes. What can we do in this direction? Those who watch my videos and read my articles already know that you need to take care of the air temperature in your homes for this. It should not be above 24 degrees Celsius, ideally 22 degrees. Humidity should not be less than 50%, ideally 50 to 60%. This will ensure normal humidity of the mucous membrane, ensure the normal functioning of the immune system. It is necessary to moisturize the nasal mucosa of a child who has a chronically congested nose. The goals are the same. Improve the work of the immune system and reduce the impact of allergens that come into contact with the mucous membrane. For moisturizing, we use either a spray with seawater. It's very important that these are isotonic preparations. Any pharmacy knows what it is. Or you buy a regular saline solution, pour it into any nasal spray bottle, and spray it into the child's nose 2 or 3 times a day. 1 or 2 sprays into each nostril. You can also try to rinse the nasal mucosa, rinse the nasopharynx with the help of a nasal aspirator. This is a special device. There are special articles about how it is done, special videos of mine. You can get acquainted with them. Take a nasal aspirator, try to rinse the nasopharynx. If it's clean, if nothing is being washed out from there, then in principle it's not necessary to use this method of treatment. But if clumps are being washed out from there, and God forbid yellow or green, then definitely rinse your child's nose with chronic congestion twice a day for long courses, 7, you can even 10 days. What else can be done independently? This will reduce the negative impact of dust, which is present in any home. For this, often do damp cleaning. Clean your apartments, your homes 2 to 3 times a day. Wipe all horizontal surfaces with a damp cloth. Frequently ventilate, definitely in the morning and evening, to reduce the amount of dust in the air in your apartment. Also, you will be providing an additional flow of oxygen, which is very important for the normal functioning of our body. According to Trelleborg, other things you can do include engaging in breathing exercises. A very cool method. It helps to restore nasal breathing and has a very good effect on adenoids if they are enlarged. Open in the search bar and enter breathing exercises according to Strelnikova for children. Get acquainted with these videos, with these methods yourself. First learn it yourself, then start teaching this child. Of course, for it to be successful, as a rule, the child should be teachable, that is, older than 4 or 5 years. But there are, of course, children of a younger age who can be taught this, so if you manage to do this, great. If not, it means this can be applied at an older age. But breathing exercises, despite the fact that it seems like some kind of method and it seems like with the help of some kind of breathing, you can restore nasal breathing. Yes, indeed, in most cases it helps. So be sure to try it, get involved. Do this every day for a while, for example, a few days, then took a day or two off, then again a few days of practice, until you achieve a good and long-term result. By independent measures that you as parents can take for your child with chronic nasal congestion. In principle, I think that's all. Now we move on to medical assistance and medical examinations, which you must necessarily undergo if the child has chronic nasal congestion. Why is this important? Because if you just went to the doctor, they diagnose you, for example, with vasomotor rhinitis, chronic rhinitis, or adenoiditis, and simply prescribe some vasoconstrictor drops, well, I think you should run away from such a doctor, because this is not treatment, this is just symptomatic improvement of the condition. And in order to treat the child, the first thing you need to do is understand why the mucous membrane of the nose swells, or the adenoids. For this, we exclude in 100% of cases an allergy to inhaled air. Second, we exclude reflux disease, which is when stomach contents are regurgitated into the esophagus. For this, you need to go to a pediatric gastroenterologist. Third, the condition of the nasal mucosa needs to be assessed to determine if there is an inflammatory process present. If it is there, then we further figure out whether it's a bacterial process or viral. For this, we take swabs, we take a scraping for chronic viral infection, we conduct an examination. It is mandatory to examine the nasopharynx during the visit to understand the condition of the adenoids. In 100% of cases, this needs to be done. This is done using a flexible or rigid endoscope. This procedure is completely safe and will not harm the child. But the doctor must visually assess what is happening in the child's throat. Whether there is inflammation there is no inflammation, how much the adenoid is enlarged in order to adequately prescribe treatment. Do not delay in examining your children if they have a chronically congested nose. Seek help in time. Please go through the examination for hidden allergies, reflux disease, evaluate the mucous membrane of the child's nose. Be sure to check the child's adenoids. And if your little one is older than 6 years, well, it's probably not a little one anymore. But if the child is older than 6 years, then be sure to do a nose X-ray to rule out sinusitis. If you have any questions, write them in the comments. I wish you and your children good health. See you later. To be continued.